Why would they tell me I was too young? But then when I had a few hot flashes, I was like, okay, this is menopause. Let's get some blood work. And my estrogen was almost non-existent. I had like less than 15. My estrogen and all my labs basically confirmed that I was postmenopausal.
Before I touch on the fact that like you can't really find the true accurate results from a blood work, at what point did you decide, because I know that you're a certified menopause coach with over 200 hours of education, so I'd love to talk a little bit about how little education there truly is out there for medical providers like OBGYNs. I was in shock to find out there's so little education, how little education there is, and what made you go into your education. Welcome to Holistic Dose, real talk from two unfiltered friends who've redefined success in midlife, found our glow up, and want to inspire you to do the same. I'm Tiffany.
And I'm Jeanette.
And today we have a guest, Julie Parana. We are so excited to have you here. She is an OT therapist focusing on menopause. So, brain fog, weight gain, night sweats, dry skin. Yeah, us too. We're dealing with it all. And today we're going to be talking about, with Julie, how we can help decode this wild ride called perimenopause and menopause for some of them who went into it early, like Julie did. So again, this show, we primarily focus on women in their 40s and up who are going through everything in midlife. And right now, this is something that we're dealing with ourselves. My 44th birthday is coming up this Saturday. Jeanette, you just
I'm 46.
46. Yes. So, we're so excited here to have you, Julie. This has been like really amazing that you're able to join us here. So tell us a little bit about yourself and your journey.
Sure. Thank you so much for having me and happy almost birthday.
Thank you.
I am going to be 45 in a couple of months. But as you mentioned, I did go through the menopause transition a little earlier than most. I had a hysterectomy when I was 42. I had a condition called adenomyosis, which is sort of like endometriosis's like evil stepsister. It's pretty similar, but instead of your uterine tissue growing outside of your uterus, it grows into the muscle wall of the uterus where it's not supposed to be. And
so, Julie, is what you had, is it rare?
I don't think it's a rare condition. I just think that it's not diagnosed very often, or women miss it because we are so used to kind of dismissing our symptoms. We're used to suffering. We have normalized to suffering as women. So if you have, uncomfortable periods and cramps and stuff, we just sort of think that's normal. And I thought it was normal until it got to the point where I couldn't ignore it anymore, until I was having horrible pain and cramping. Even when I didn't have my period, I just felt like pain and pressure down there. And then the bleeding just was incessant. Sometimes I was bleeding up to 35 days consecutively.
Wow.
So it was just to the point where I couldn't continue that. It was just ruining the quality of my life. I had already had my tubes removed when I was in my mid 30s. So I really had no use for this uterus that was causing me so many issues. So I had asked for an elective hysterectomy to get rid of that thing. And I'm really glad I did. But
was it really hard for them to accept that when you finally decided to make that choice? Did you find anybody that, in your medical experience that you've went through that was supportive and willing to listen to you, or was that a big hurdle?
Thankfully, that was not a hurdle. The surgeon that I went to was absolutely on board with it. She said, yes, no issue at all. I definitely did not have to convince her in any way whatsoever. The only downside of this whole experience is that my ovaries were left intact. So I was reassured by my surgeon and by my OBGYN that my hormones would not be impacted at all. So I recovered very easily from the hysterectomy. And I, didn't have pain, wasn't bleeding. It was great. But within a few months, I started to notice some symptoms that I just wasn't quite feeling like myself. But I did not recognize those symptoms as menopause because I didn't know what happens to women in menopause. All I knew was hot flashes and night sweats. So when I started having brain fog, memory lapses, word finding problems, really dry skin, rashes, and like new allergies out of nowhere, things that I've used forever, I was suddenly having allergic reactions to. I had tinnitus ringing in my ears. I was getting sort of
Oh,
bouts
I
of
had that.
dizziness and vertigo,
Mm.
all these like random things. It took me a while to realize this is probably hormonal. And even when I initially asked, when I started to think, hey, this might be a hormone thing,
Yeah,
my doctors were like, oh no, you're too young for menopause. And like looking back on it now, that's so silly. I was 42 and I had a hysterectomy.
right.
Why would they tell me I was too young? But then when I had a few hot flashes, I was like, okay, this is menopause. Let's get some blood work. And, my estrogen was almost non-existent. I had like less than 15, my estrogen, and all my labs basically confirmed that I was postmenopausal.
Wow. But
Interesting.
women don't, before I touch on the fact that like you can't really find the true accurate results from a blood work,
Yes.
um, at what point did you decide? Because I see, I know that you're a certified menopause coach with over 200 hours of education. So I'd love to talk a little bit about how little education there truly is out there for medical providers like OBGYNs. I was
Right.
in shock to find out there's so little education. So I'm curious to know your experience with that, and if you can let, our listeners know how little education there is and what made you go into your education.
Right, absolutely. So once I realized I was postmenopausal, by the way, I just got a message in my portal that says you're postmenopausal. No, no offer of any education, explanation, no suggestions on what to do, no offer of menopause hormone therapy. And I was 42. Like I went through this a decade before I should have. And
Right.
it
So
was,
I actually have a question. So I've heard
yeah,
that like the definition of menopause is you haven't had a period for 12 months, but
right,
you didn't have a uterus.
right.
So
So
what did postmenopausal mean?
yes. So if you don't have a uterus, you won't know your magical menopause date. And the menopause is the day at which you have gone 12 months without a cycle. But
Oh,
if you've had a hysterectomy, you won't know that date, and so they'll really just determine that based on your labs. So it'll
Okay.
be, what your estradiol is, what your FSH, what your LHR, that will determine. And technically, you should have labs run a few times to confirm that because you could
mhm.
still be in the perimenopause state where the hormones are fluctuating.
Fluctuate.
Um, but in my case, I didn't bother with further testing from that because I knew my estrogen was less than 15.
Yeah.
I had every symptom in the book almost.
Right.
So I knew I was postmenopausal. And
Mhm.
and yes, offered no education, nothing, just told that I was postmenopausal. So I
You
started,
basically skipped the peri and went
yes.
to the menopause and went to
Although
post.
now looking back on it, I think I was in peri. Again,
You just didn't
I
know.
just didn't know what it was. I thought that you just get a few hot flashes and then you're postmenopausal and you never have to worry about your period again.
Well, and it seems that
Um,
it varies so much by woman too, because I've
yes.
asked my
Mhm.
mom, because I've had a couple of hot flashes, just like random, and then a year goes by, and I don't have one again, and
Right.
so I asked my mom about what was going through menopause like for her, and hers was apparently a breeze. Like she was
Yes.
like, nothing really happened. She just stopped getting her period." I'm like, oh,
Yeah.
that's
Is it a
nice.
breeze? I always wonder, is it a breeze or is it that society has just taught us women that all these symptoms are so natural? Because
Right.
Julie, you can speak on this. The laundry list, when I looked into it, and I have other friends who say, "Oh, I'm not in it." I'm like, well, perimenopause by definition is what, the 7 to 8 years prior to menopause. So it could
Correct.
be as early as 37 or 38.
Yes. Yes.
So you are in it. And then my friends will say, well, I went to my doctor and I got the blood test and it doesn't say anything. I'm like, because it's symptoms based. So I would
It
love for
is
you to
symptoms based. Yes.
explain a little bit about that, I think it's just people are so used to hearing the term and you automatically think you're old and nobody wants
Right.
to accept it, right?
Yes, well, I think a lot of reasons that people miss the symptoms is because we associate menopause with old ladies. And
Mhm.
as you said, the symptoms can start in your mid to late 30s. And, I, once I realized that I was postmenopausal, now this is all I ever talk about. And I have heard from so many women that they said the same thing, that their doctors tell them that, I got blood work and it was normal. But as to your point, your labs can fluctuate so much during that stage that lab work
Mhm.
isn't necessarily valuable because one day your estrogen could be 300 and then the next day it could be 25 and you don't know when you're going to test. So you could very likely come back in the normal range, but you don't feel normal because your
Right.
hormones, in premenopause, our bodies are used to the 28-day cycle where our hormones rise and fall in a very predictable pattern. And we get used to that pattern. And then in perimenopause is when there's no rhyme or reason. They call it the zone of chaos, where your levels are fluctuating so wildly that that's why you feel crazy. So your lab work might say it's normal, but you don't feel normal.
Do you know if women with PCOS experience perimenopause and menopause differently typically?
Jeanette, you has
Yeah, I
this.
have
Yeah.
PCOS.
Yes, they can absolutely. I think it can be worse for sure for some women. You know, every woman's different. I think it also what you do with your nutrition and your diet and your
Mhm.
sleep and your stress, all that plays a large part in it. Not to say if you have healthy habits, you're not going to experience any symptoms, but it can significantly lessen them. So it really just depends. But there are definitely women who have PCOS or endometriosis, or PMDD is another
Yeah.
one where the perimenopause transition can be even more difficult for them, for sure.
Interesting.
So we were so shocked to hear about the lack of education that really is out there. So tell us a little bit more about what inspired you to then go through your training and what that looked like.
Sure. Yes, I was shocked to learn that physicians really receive little to no training in menopause. Only about 20% of OBGYNs even get any menopause training. So, no wonder. I was a healthcare professional and I learned zero about it in school. And so I decided to get my women's health certification, and then I took two separate menopause coaching certifications. So I just really delved into the evidence-based research that's out there on what can help women in this stage, as far as what we do with our exercise routines, with nutrition, with sleep and stress management. And then also I did a lot of research on menopause hormone therapy, and I found out that a lot of what I thought I knew about it, what most women think they know about it, unfortunately, there's a lot of misinformation out there based on outdated studies, and there's just a lot of myths perpetuated about it. And so once I did my research and learned what a safe and effective treatment it is, I started it.
And that's something I've heard a lot, especially from like boomers. My boomer mom,
Yes,
when she found out that I was doing the topical HRT, was like,
yes,
"Oh my God!" Like, kind
yes,
of, why are you doing that? So why is
Mine
it that
too.
the older
yeah.
generation thinks it's bad?
Sure. So there was one large study that was the Women's Health Initiative study, which was to look at the safety and efficacy of hormone replacement therapy. And unfortunately, in 2002, they prematurely halted that study. And the media was kind of screaming from the rooftops that this study was discontinued because it increased the risk of breast cancer. Unfortunately, that study had a lot of design flaws and the results were misinterpreted. So in that study, the women were getting a form of hormone therapy that is rarely prescribed anymore. They were getting synthetic hormones. They were getting an estrogen and progestin, a synthetic progestin, and they were also getting a much higher dose than we really commonly use today. And then the other issue with that study is that a lot of the women the average age of the woman in that study was 63 years old, and many of them already had comorbidities and pre-existing
Yeah.
That blew my
cardiovascular.
mind.
Yeah.
Mm-hmm.
So we were studying the wrong women, and we were also, even if you look back and reanalyze the data from that study, even with that hormones that they were given, the synthetic hormones, if you just look at the data from the women who were prescribed it at or around the age of menopause, they had amazing outcomes. And the women
Wow.
that only got estrogen, so I only take estrogen because I don't have a uterus. So if you
Yeah.
don't have a uterus, you can take just estrogen. You don't need to take progesterone also. And
Oh.
the women in that study who only took estrogen because they didn't have a uterus, they had a 23% reduced risk of breast cancer.
Mm.
And
Wow.
those that did get, it was actually not even statistically significant. It was like one additional case per thousand.
Oh,
In
wow.
the it's the women in the combined group who were getting estrogen and progestin that had a slightly increased risk, but it was not even a statistically significant increase.
Mm.
And now, for the last 25 almost years, women have been turned away from this treatment. And, if we look at the data we have now and we look at the newer bioidentical hormones that are available, It's extremely safe. They are meant to, they are molecularly, structurally the same as the hormones that your body has produced your whole life. So they bind to your hormone receptors in the exact same way. So your body recognizes them and processes them the same way they did the estrogen that you have made your entire life. And if the estrogen you have made your entire life has not been harmful to you, why would this therapy be harmful to you? So that's what I just really want women to know, that it is a safe and effective treatment. Not everyone is going to choose it, and that's totally okay. I just
Right.
want to make sure that women are making that decision based on the right information and the current data and relevant facts, and not just because of misinformation. And unfortunately, a lot of doctors are still perpetuating that misinformation because they haven't stayed up to date and they weren't trained. And
When I
so,
went to my doctor and I didn't say, hey, I think this is perimenopause. I just said, I have been so fatigued
yes,
for
Mhm.
like 2 years. I am just so tired. And she just said, take B12.
yes.
That was like that was all she
Yeah,
said, was just take B12. And then even at my like next physical, I said, still same issue. And she kind of shrugs her shoulders, just keep taking B12. Like,
right.
okay. So what do you recommend for like a woman in that situation? Like what kind of doctor do you go to, since most
Yeah,
PCPs
Yeah.
aren't
right.
trained?
Since most aren't trained, and in the beginning of all this, I encouraged women to sort of advocate for themselves and try to, bring their doctor up to speed. But I've since changed my opinion on that because I really feel like there's a skill to prescribing hormone therapy. It's not a one size fits all dose that every woman
Yeah.
just slaps on the same dose patch and they feel better. Often women really have to, it's a trial and error process. You have to figure out what dose works for you, what delivery method. So are you going to use a patch? Are you going to use a gel? Are you going to take it orally? Are you going to take progesterone and estrogen if you don't have uterus? If you don't have uterus, you can still take progesterone. Many women still take it and benefit from it. There's a lot of nuance and skill to prescribing it. So now
Yeah.
I feel like rather than try to convince your doctor, who is probably not trained in it anyway, just try to find a menopause expert, a specialist. And
And
Okay.
is this a bit what you work with your clients in your coaching, going
yes,
through the right avenues?
yes, just trying to help them find someone to go to for sure. But that's part of it. I think, unfortunately, there's not enough out there for all the women that need their
Yeah.
services, but there are physicians that are trained in this. The North American Menopause Society has a directory that you can search for a
That's
provider.
great.
There's a great clinician, Dr. Heather Hirsch. She is sort of one of the leading menopause experts, and she has an academy where she trains clinicians how to prescribe HRT.
Mm.
And so she has a directory where you can search for people that have taken her course and have been trained by her. And then there are a lot of great telehealth platforms now that specialize in menopause care, which is great because there are so few doctors that have this specialization that if you Google trying to find one near you, you may not find one near you. And
Yeah.
I ended up switching to telehealth myself because my doctor that originally started prescribing to me retired, and then I met with another clinician and for my just annual exam, and she admittedly said, I don't know how to prescribe this. I haven't prescribed it. She was a great doctor. By the way, just because they haven't been trained, it doesn't mean they're bad doctors. You may
Right.
love the OBGYN that delivered your babies and that took care of you in your reproductive years. Please don't feel like you're breaking up with your doctor if you don't
Right.
go to them for your
Yeah.
menopause care, because, a lot of great clinicians just were not trained. And so if they didn't
Right.
go outside of their training to get this specialized education, then they're probably not going to be able to prescribe hormone therapy to you. But that doesn't make them a bad doctor. It just means they don't have that training.
So
Right. And
have
I'm
you found that through telehealth, they are able to customize it? Because I have tried telehealth
Mhm.
and I did it for like 6 months, the estrogen and progesterone, I guess, the cream,
Yes.
and it did nothing. I don't think the company I'm with is one that's really going to work with me and tweak things and try
Uh,
a patch versus cream,
right.
etc.
And I was going to say that is why I'm partnering with a team of people to launch an online women's telehealth. We started in the GLP-1 space. And what I learned through that was in losing 85 pounds, and Jeanette, you've lost like 120, and something I didn't know is that when you lose a lot of weight like that, you're losing estrogen
Yes.
from the fat loss,
Mm-hmm.
and that can actually push you in sooner. So that is what I experienced 2 years ago when I started waking up like drenched in sweat, and now being on a GLP-1, I'm cold all the time. So I just figured, okay, it's a side effect of me losing all this weight that I go to sleep with the socks on, I bundle up in sweatpants, hoodies, and I'd wake up drenched to the point where through my sweatshirts, through sheets, everything, my blankets, and then still drenched. And I was like, okay, this just must be because of that, to the point where I have to change the sheets and everything. And I experienced that several times, like throughout a couple months. And I told my mom, and she's like, no, that's night sweats. And I was like, what?
Night sweats,
Like, are you kidding me? And she was like, yeah, unless you're sick, like have the flu or something where your body's sweating it out, that's night sweats. And then I realized, and then if my neighbor had told me, Monica, she was like, no, actually that's because of the weight loss. And the two are connected. So, you know, we launched orally meds, and people are losing weight, and then they're going into these other symptoms sooner. So we're like, this is a perfect, you know, synchronization that we're going to be launching Lumivira and in the next couple of months because of that, to work with it. But there's not as many options available.
Right. And it is, hormone therapy is definitely a trial and error process. So, you know, some women can get discouraged because they don't feel better right away. Often clinicians will start you on a very low dose. So, you know, my doctor did the same with me. She started me on a 0.025 patch. And like looking back on it now, that probably wasn't necessary because we knew I had no estrogen. So I probably could have started on a higher dose, but you know, they often just want to see how you're going to feel, and they want to minimize any negative side effects
for them too, that they're working in.
Yes. So, you know, it took a while for me to get up to the dose that worked for me. And then the other thing with the transdermal methods is, for some women, one brand of patch may work better than another. So I'm really glad that I started on a patch brand that worked for me, because I was switched. My pharmacy switched brands on me one time, and all my symptoms came back. I wasn't absorbing it the same way. And so I thought to myself, you know, if I had started with this brand, I probably would have been frustrated and thought that hormone replacement therapy doesn't work. So, you know, that's why I tell women, please give it some time and try it. It may take a year to figure out the right dose, the right delivery method, the right combination, the right brand, all of it that works for you. Once you figure it out, it's absolutely worth it. You know, the relief that I have from it is great. It's just, you know, it definitely takes a while. I'm sure there are some women who just, you know, start it and right away and it works for them and they found the right dose, and, you know, that's probably like the unicorn patient out there. I think most women, it does take a little while to figure out and get their hormones optimized so that they can feel their best.
What are your thoughts on the pellets?
So I know some women love their pellets.
Yeah, I know several people who are like, oh my God, it's been amazing. So I thought about it. I tried the topical and I was like, maybe I should try pellets. Yeah, it's kind of sounding like I should try some other things.
Right.
First.
I mean, granted, again, I'm not a physician. I don't prescribe menopause hormone therapy. I'm just speaking from my experience with what I've taken and with what, you know, I've seen my clients do. And the pellets are not FDA approved, which is the first downside of them. Often, and they're expensive. So my hormone therapy is covered by my insurance. I pay $5 a month for my menopause hormone therapy. It's, you know, a $5 copay. Pellets can be very expensive. The other issue with pellets is that once they're in, they're in. So if you have negative reactions to them, if you have side effects you don't like, you have to wait it out 3 to 4 months before your body absorbs all those hormones. There's nothing you can do. Whereas, like, if you're wearing the patch and you don't like the side effects you're having, you just pop it off. And pellets often, it depends who you go to. I'm sure there are very skilled providers who, you know, are monitoring your lab values and all of that. But there are a lot of women who go to med spas and get pellets, and they're dosed so super therapeutically that their numbers are way, way, way too high, and they can have a lot of complications and negative side effects to them. Again, I know many women who have taken the pellets and they feel great. And if you're using them now and you're not having any negative side effects and you feel great, I don't think that there's really a reason to change anything if they're working for you. I just wouldn't advise that be someone's first dipping their toe in the pond, because if you do that and you have all these negative side effects, there's really not much you can do. Like I said, you just have to wait it out until your body absorbs it.
So you
Got
talked
it.
about estrogen and progesterone. Some women take testosterone
Yes.
too, right?
Yes. Yeah,
Okay.
testosterone is a human hormone. It's not just a male hormone. And it's
Hmm.
maddening to me that it is not FDA approved for women and that there's not an FDA approved formulation designed for women because we need testosterone just as much as men do. We just need less of it.
Yeah.
But
Yeah.
actually, we produce more testosterone than we produce estrogen, believe it or not. So
Really?
yeah, so
Wow.
it's not that we don't need it or benefit from it. It's just that, FDA has not gotten up to speed on how biology works.
Hmm.
And so, yeah, it's very frustrating, but I have not tried it myself yet. I'm definitely not opposed to it. I think what makes sense for most women is start with the estrogen, start with the progesterone if you have your uterus, or even if you don't, you can try it and see if it helps. Progesterone helps a lot of women with sleep significantly, sleep and
Hmm.
Mm.
mood. So if sleep and mood are issues for you, even if you don't have your uterus, try progesterone. Um, and then testosterone is kind of like the icing on the cake. If you still don't feel amazing yet with your other two hormones, the problem is finding someone who knows how to prescribe it off label to you as a woman and they know how to alter your dose to give you so you're not taking too high of a dose for a woman. But I think it can be amazing for women who are struggling with libido. It can be amazing for women who just have low energy and decreased mood, even though they are trying the other hormones. If they're still not feeling great, it definitely is all for women trying testosterone.
I love that. I wanting to break down just in case this is too much information overload
Mm-hmm.
for people, but in a nutshell, like perimenopause 101. So
Yes,
how do we define the three stages, between the peri, the menopause, and the post?
sure.
So if we can cover that.
So premenopause is you're in your 20s, your 30s, you're at peak fertility, you have normal cycles. And then perimenopause can start in your mid 30s and go up until you're postmenopausal, which can happen anywhere. I think the average age is 51 in the United States, but 45 to 55 is considered a normal menopausal age. And it's that lead up to your last period. So that's when your hormones are fluctuating wildly. There's no rhyme or reason to them. And that's when your symptoms are actually the worst because of the crazy hormonal fluctuation.
And that's
So,
another thing, yeah, I would love for you to chat on is like, what are those symptoms that people, are looking out for? Because guaranteed everybody has them.
yes.
There's so many.
And
So,
I blamed a lot of them on being overweight, which I think is
oh,
a whole
yeah,
nother topic about the
yes,
medical community. Even doctors will be like,
yes.
"Oh, you're overweight."
You just need
But
to lose
Right.
yeah,
weight. Yeah,
my
the
fatigue, I was
standard
just like,
prescription for women is like you're over the weight
yeah,
and take the pill. That's like
yeah.
just lose some weight and take the pill and you're gonna be fine.
Yeah, so I lost
Um,
120 pounds and I'm still tired. And I'm like,
oh yeah.
it wasn't that.
Yeah. So symptoms, it could be anything from, like we talked about, the brain fog, the memory lapses. Anxiety is very common in women in this
Mhm.
stage. So
Hmm.
all of a sudden, especially if you've never felt anxious before, but all of a sudden you're
Interesting.
driving anxiety is a huge thing that women will notice. They
Really?
suddenly have fear of driving or traveling. Um,
Really?
yeah.
It's funny. Jeanette and I talked about this actually yesterday when we were saying how we like hate leaving the house and that ever since COVID, it's weird,
Yeah.
but like even I was like, "Oh, can you come pick this podcast mic up for me or
Yeah.
something else?" She's like, "Ah," and I'm like, "I'll bring it to you." But ever since COVID, which
Yeah.
we were in menopause then,
Right.
we don't want to go
Yeah.
anywhere,
You
and
just
I
want to go
do have
anywhere.
that fear of driving. It's bizarre.
See,
I
for
Yeah.
me,
never
it's
knew
not
that was
anxiety
something.
or fear of driving. It's just laziness.
It's just not feeling like it's just
Yeah, I want to
lack
go
of
somewhere.
motivation. Yeah, lack of motivation. But anxiety is a big one for some women. Sleep
I've heard about too,
disturbances,
like, was it something with the shoulder?
Oh,
The
my
frozen shoulder.
shoulders.
Yes.
Yes.
So that's
What is that?
the musculoskeletal syndrome of menopause. So estrogen is very anti-inflammatory, and we have hormone receptors all over our bodies. So this process affects every organ system, every bodily
Wow.
system that we have, and it definitely can lead to joint pain and stiffness. So plantar fasciitis and frozen shoulder are very common manifestations of menopause. Palpitations is another very common one. A
Mm.
lot of women
I
end up
started
in
experiencing
the
that.
ER because of
Yeah.
palpitations. And I do want to say, like, so grateful that menopause is sort of in the forefront now, and women are talking about it, and we're becoming aware of the symptoms. I do fear that like anything in the medical community, the pendulum's going to swing the opposite way. And
Mm.
instead of missing these symptoms altogether and not connecting them to menopause, we're going to start saying every
Everything is
symptom a woman has is menopause. And
kind of
while
like
that,
the obesity, like everything's
right,
obesity, or
And then
yeah,
you're going to miss you having a
yeah,
heart
yes,
attack.
correct. So while I want women to be aware of the potential
yeah.
symptoms and listen to their body, there are definitely indications where it is totally reasonable to rule out another cause of your symptoms. Don't assume it's menopause. It's,
Yeah.
especially if they're, if you're having insane palpitations every single day, and it's,
Mhm.
that is something you want to get checked out. Don't just assume it's menopause. But often, a lot of these symptoms are menopause, and the average woman will spend about 5 years dealing with these symptoms and see 5 to 7 specialists before she figures out that
Wow.
her symptoms are menopause related. And
Wow.
usually it's the woman herself who figures out that the symptoms are menopause
Of
related.
course. Well,
So,
let's also talk about, brain fog, the sleep, your skin, mood swings, because
yes.
that's another thing too that like take my memory, like I'm so good with memory, remembering things that like, yeah, now I'm having difficulty speaking.
Yeah.
But, to all of a sudden have that brain fog, oh, it's like debilitating.
Yes, I honestly thought I had dementia because those were my first symptoms. And
Wow.
early dementia does run in my family. So I started to freak myself out because I was forgetting things. I was missing appointments. I was making mistakes at work with like my billing, which I've never done like that before. And like the word finding sometimes was so bad. I'd be speaking to my patients and I just felt like I had a stroke. Like I just
I've
could
had
not
word finding
find.
issues. I've Googled like, is this early dementia? Not like
Yes,
basic
Yes.
words like ladder or like,
yes,
Like
just
I
things
literally
really
start
simple.
feeling like, am I dumb? Like what is
yeah.
wrong with me?
You're
It's
not dumb. And
bizarre.
actually, so the fun fact about this is that despite the fact that we do experience a little bit of a cognitive dip or decline,
Hmm.
women in their menopausal years still outperform men on cognitive testing. So even at our worst, we are still better than them at their best. So don't get yourself too worked up about this, but it can be distressing. It's like your mind is just not, women are very used to being able to multitask and
Yes.
Yeah.
just have a million
Hold it all
things
together.
going in our brain at one time. And during this transition, that becomes a lot harder to do. And so, you're recognizing it in your mind. You think, oh my God, my word finding is terrible. Like in reality, it took you like 0.2 seconds longer than it
Yeah.
normally does to find the word. So, but not to say that, real brain fog doesn't happen, but it's, women, I don't want women to think that they have dementia. You don't have dementia. And for me, anyway, hormone therapy has significantly helped my brain fog. So
Mm,
has prioritizing my sleep. So if I
Mhm.
do not
yes.
sleep well for a few nights in a row, I notice that some of that does come back. I have a hard time finding my words, or I forget things, or I make, billing errors or things like that if I've gone a few days without getting a good rest.
Well, we all desire to have good sleep, but then that is one of the side effects too. So
Yes.
how are people combating that? Because that was one of the things too. Like I always was fine sleeping. And then once I started going through those night sweats,
Yes.
I realized like I tried to go to sleep and then I would just be up and then the exhaustion sets in the day and you haven't
I
slept and
can
it's,
sleep fine during the day.
yes,
It's like I can take a nap in the afternoon, no problem. But even if I make myself stay up, it's harder at night.
Yeah, I'm not a napper. I've never been able to do that, but
oh, I've become a pro napper.
setting consistent like bedtime and wake routines is super important. So I used to be a sleeper inner on the weekends, and I
Mhm.
now don't do that anymore. It does help your body if you stick to a schedule and you go to bed and you wake up around the same time. It can be within an hour, but
Mhm.
you really want to try to set a consistent sleep schedule, have like a bedtime routine, a wind down routine. Avoiding screens is
Did you
so
say
huge.
wind down routine? No,
Wind
Oh,
down.
wind down.
no, I know.
Wine is actually not going to help you sleep. And actually,
Yeah.
I completely gave up alcohol because it was
Oh,
totally destroying my sleep. And I wear an Aura ring and it helps me track my sleep and see all my.
uh-huh.
The data was very clear. Alcohol was not
Interesting.
doing me any favors. And there were other reasons that I stopped drinking it too. It was always a net negative for me. It never
Right.
was worth it. And I can have a mocktail and still enjoy company and going out to
Yeah.
dinner. And it's just so much better that my sleep, it really impacted my sleep. And not even just the day that I drank, but even for a few days afterwards, it would
Wow.
I
still,
noticed that too. Just being on
yeah,
the GLP-1s, like I feel hungover for days, even if it's
yeah,
just one or two, like barely 2 glasses of wine, and I'm
right.
like, I
Yeah,
can't
yeah.
function.
It's just not
What
worth
about
it.
some of the common myths that people think, for example, like if you still have your ovaries, you're fine.
Right. Well,
What are some of those other ones?
yeah, you might be fine. In my case, I was not fine. And for most women, so I think going into like immediate menopause after a hysterectomy where your ovaries are left intact, that's probably pretty rare. I think that may have happened to me because I had also had my tubes out. And so I had two surgeries there, and I think my ovaries just lost all blood flow. But even for women who have not had that and just have a hysterectomy and with their ovaries left intact, it can typically it's like a 3 to 5 year earlier scenario that they'll go into menopause a little earlier because blood flow can be impacted. I think other myths, a common one is that if you're still having regular cycles, you're not in perimenopause, and that's definitely not true.
Mm,
So even if you're getting a period every month, if you're having the other symptoms, if you're having the anxiety, if you're having trouble sleeping, if you have really bad dry skin or irritability, or you're gaining weight, all these things, you definitely can be in perimenopause, even if you're having a regular cycle.
Well, I know that like tracking your cycles is really important, but for myself, like I have an IUD
Yes.
and
Same. Like I don't get
Yeah, so you
periods.
can't track it. Yeah, you can't go by that. So
I used to get like every couple of months, like a little trace of something. I get nothing now. So my daughter is going to be almost 15, Gabby. And like when has her period or I start noticing her mood change, I was like, is it period time? Cause then I know that I'm probably in that realm because
yeah.
I'm feeling a little weird, but like, what do people do, that are on an IUD? How do you even
Yeah, you won't
not?
know. You won't know when you can't track your cycle. So you can track your symptoms if you want. I don't know. I never really have my clients track their symptoms unless they want to.
Okay.
If it's useful information for them, then I say go ahead. It can't hurt you. But
Are they
if
tracking their
if you're
cycles?
forcing yourself to track every single symptom you have, sometimes that just it's added work on your part. It makes you stress about it more,
Mhm.
at the end of the day, I don't know how helpful that always is. But if you do still have a uterus or you don't have an IUD or all of that, then tracking your cycle can be helpful just so you know when you have gone the 12 months without a
Yeah.
period. So then you can celebrate. I don't have to worry about this anymore.
Yeah.
The other myth is that you're through menopause. There's no such thing.
Mhm.
You are menopausal until the day you die. So
Oh,
menopause
wow.
menopause is the one day that you have gone 12 months without a period, if you still have your uterus. Um, and then you are postmenopausal until the day you die. So a lot of women start to feel better once their hormone levels stay stable and consistent and they're not fluctuating up and down anymore. Even though our hormone levels are low, they're stable. And so then you don't experience, all the symptoms that you did during the perimenopause stage. But some women can still have hot flashes even into their 70s and
Hmm.
80s.
Really?
Yeah. So that's why personally I will be taking menopause hormone therapy until the grave. I do not plan to stop it. It is absolutely safe to continue taking it as long as the risks outweigh the benefits. There's this sort of old adage that you can only take it for 10 years or that once you're 60 years old, you shouldn't take it anymore. And that is not the case. The North American Menopause Society position paper on menopause hormone therapy supports continuing it well into your 70s and 80s as long as it's, still safe for you to do so. As long as you haven't had a change in medical condition that warrants stopping it. And we know it has so many benefits. It reduces your risk of osteoporosis. It reduces your risk of cardiovascular events. We really need to maintain our bone density as we
Yeah.
age, and estrogen is vital to that. So,
Hmm.
I will be taking my patch to the grave with me.
Now, I know you mentioned, sleep is a really good routine to get on. Of course, nutrition. What are some other things that, for lifestyle changes that can help? Other supplements that, ladies should be taking?
Supplements, don't go out and spend $1 million on all these kind of supplements. I don't know if you guys follow Kelly Casperson, Dr. Kelly Casperson. She's one of the amazing menopause
Maybe.
experts. I highly recommend people follow her, but she had a funny post the other day where she said, you know what menopause isn't? It's not an ashwagandha deficiency. Some women love ashwagandha. I'm not saying you can't take it, but like, is
Right.
it going to cure your menopause? Probably not. It's an estrogen deficiency. It's not an ashwagandha deficiency. And that's,
Marketing is everything. And that's
yeah,
where they get these ladies
yeah,
signing up and ordering everything under the sun. And
yes,
it's like,
yes.
what do I
Now,
really
can you
need?
supplement? I supplement a few things. I take creatine. I've been taking that.
I started taking that.
Yeah, I've
I've
been
heard
taking that.
magnesium
Yes,
is
and I
a
do. So
really good
magnesium is
supplement.
great. I take magnesium. I think it helps me sleep. And it also helped. I was having restless leg syndrome, and
Me
I don't
Mm.
too.
have that when I'm consistent with my magnesium. So magnesium I take. I take vitamin D just because I was deficient in it on
I'm
blood
typically
work.
deficient as well.
Yep.
Yeah, and the creatine. But other than that, I mean, you really don't have to, follow your doctor's advice. If you are deficient in something, then yes, you can supplement it. But I think I wouldn't take a whole bunch of supplements and not change anything about your lifestyle and expect them to really help. I think if we clean up our nutrition, really focus on protein, really focus on fiber, and then as far as exercise, strength train. You
Mm.
really need to be strength training, lifting heavy weights. So that's what my clients work on. Every 4 weeks, they get a new strength training program. We make sure that we're, working
Oh,
on progressive overload, that we're building muscle, and we're maintaining our bone density because that is
how often are
huge.
you recommending that they do strength training a week? I just signed up for the Ladder app and
Oh,
I'm like
fun.
really enjoying it.
Yeah.
Yeah. And I chose a trainer that focuses both on like Pilates movement, but also strength training
Yes.
too. And I've been really enjoying it. But how often are you recommending people are doing this a week?
2 to 3 times a week for strength training is really the minimum you should be doing. And making sure that it's, obviously, if you have not strength trained at all, you can't just jump right into super heavy weights. You have to
Yeah.
gradually work your way up to it. But women have been conditioned to be cardio bunnies and to
Mm-hmm.
spend a lot of time
Yes.
on cardio equipment. And they're worried about lifting heavy and being bulky.
Bulking
And
up.
that's just not going to happen. I'm so glad I fell in love with heavy weightlifting when I was like 30 years old. So I
Mhm.
already had that habit of heavy strength training down, and it's definitely helped me. I just had a bone density scan a few months ago, and my bone density is like off the charts. And thank God, because going into the menopause transition a decade earlier, bone density is a real concern we lose like, I think it's like 10 to 15% of our bone density within the first
Wow.
5 to 7 years after the
Mm.
menopause transition. It's a very steep drop of our bone density. And that's the thing that's more likely to land you in a nursing home, honestly, is
Yes.
frailty, low sarcopenia,
Mm-hmm.
losing your muscle, losing your bone. And I've treated hundreds of women in my career as an occupational therapist who have had hip fractures.
And then
And
they don't recover from it. I heard
and they
that's one of the
don't.
number one
Yes,
Yeah.
it's
cause
a
of death. Yeah.
very high rate of mortality, very high.
Mhm.
And
Mm-hmm.
even if you do survive it, many of these women end up, in very poor states of health to them,
Wow.
and in nursing homes. And it's preventable. It's preventable if you really, work hard at maintaining your bone density and your muscle mass, and also by replacing your hormones.
Wow. What are some tips that you can give to women who feel dismissed or overwhelmed by their doctors?
Well, find a new doctor.
That was what popped into my head. Your doctor.
Find a new doctor. Your doctor's just likely not informed. And I think the more of us that speak out about this, I think, I'm kind of like the cusp. I'm like Gen X, where I think we're just not sucking it up and suffering through menopause like maybe the women before
Agreed.
us did. We're willing to talk about this and say, like, hey,
Yeah.
you absolutely do not need to suffer through this stage of life. There are things that you can do to feel better. And if your doctor isn't listening to you, it's probably because they're not informed. And some doctors just have a little bit of a humility problem. So if they weren't trained anything about it, they, just dismiss your symptoms
Well, it's
instead of
ego.
referring you to a physician that
Mm-hmm.
knows how to treat this. They'll just sort of say, hey, this is a normal stage of life, there's really nothing we do for that, and that's not
Right.
true. So find another doctor, find someone who will listen to you.
Well, I love, I found you on TikTok, which is awesome. I've been
Yes.
meeting so many amazing people there, but I love one of your recent posts when you went to go pick up your prescription.
Oh,
And
yes.
Yeah.
so tell us about that.
Yes. Oh, I'm glad you mentioned that because for women who maybe they have learned about hormone replacement therapy, but maybe they still, for whatever reason, they don't want to take systemic therapy. I really think every postmenopausal woman, even perimenopausal woman, should be offered and should be using vaginal estrogen. And there's so many benefits to vaginal estrogen. It prevents dryness, it prevents UTIs, it prevents vaginal atrophy.
Is that
It's
where, like, I see this on TikTok where your labia disappear? Is
Yes,
that what you say,
that
vaginal
happens.
atrophy?
Yeah, well,
Have you
Yeah,
seen
I'm
this,
break it
so
down
Tiffany?
to like the easy
that's
term
There are women
here.
who are like, my labia are gone.
yes, that actually can happen. But vaginal
Really?
atrophy that I'm referring to is like
Different.
actually the tissue inside,
Okay.
and
Oh.
that's going to
Will
happen
the
to.
topical estrogen help with your labia not disappearing
Let me
though?
tell you, in our friend text with Jeanette and our other friend Amanda, we take pictures of all aspects of our body and share. And we're like, is
Yeah.
this normal?
Not our labia though. I have not
But
seen
we
that.
haven't done that yet. But I'm like, what's going on?
Yeah. So vaginal estrogen, super, super safe. It does not get absorbed systemically into your bloodstream. It only acts locally in your vagina. So why wait to have a dry, uncomfortable vagina when you could just
Yeah.
use some vaginal estrogen? Um, I think really every woman should take that. And the fact that it reduces your risk of UTIs by 50%. You know how many older women die because
My
of
grandmother
sepsis?
died of a UTI.
Really?
Sepsis,
Yeah.
urosepsis leads to death in many older women, and it
Yeah.
really could be prevented with just vaginal estrogen twice a week. So if you
Oh,
don't
you
want to
only
take,
use it twice a week.
yes,
That's it?
yeah, you just use it twice a week, and you can
Oh,
take both. So in that post, it was I went to pick up my hormone therapy, and I was getting my topical or my estrogen patch that I wear. That's systemic hormone therapy, and then I was getting my vaginal estradiol, which is just for the local vaginal symptoms. And the pharmacist came over and was like, "You can't take both of these together. That's too much estrogen," and that's absolutely not true. It is absolutely not true.
you're
Um,
like, no, no, no. Actually, you're
and there were
misinformed.
a lot of women in the comments of that post who said the same thing has happened to them. And then there was one
Really?
woman who said
Wow.
that her doctor even told her that you can't take both. And that's totally, I just unbelievable to me that doctors would tell somebody that you absolutely can take both. But if you don't want to take both, if for some reason you are afraid or you don't want to take menopause hormone therapy, you absolutely can. It's safe for everyone. It's safe for women who have breast cancer right now. It's safe for you if you've had a history of cancer. So if you're not a candidate for systemic menopause hormone therapy, there's absolutely nobody who cannot use vaginal estrogen. It's safe for everyone.
And estrogen's also good for your skin, right? Are
Great for your
people starting to
skin.
use it on their face? Do you use
Yes.
it?
And
I
that's
haven't tried
Uh,
it.
been, did you or weren't you using that one, Jeanette, or
I've
no?
thought about it, but I asked someone on TikTok, I think I've called a dermatologist, and I said, can it make melasma worse?
it
And they said it
can.
can, and
It
I have
can.
melasma.
Yes. So a lot of women take a tiny little bit of their vaginal estrogen, not your systemic estrogen. By the way, someone in one of my comments on my post just asked me about this the other day. She was taking her estradiol gel, her systemic
Oh,
estradiol
not
gel,
same.
and she was putting that on her face. I said, "Oh, please don't
No.
do that. It's a way too high a dose to put on your face, but it also is alcohol based. That's not what you want to do."
Is
So
that the one that they say, like, if you have young children, things can pass on to them? That's what
yes.
I'm confused on which one that is.
Right. Yeah. So systemic hormone therapy can be topical. You can get it in a patch. That's what I wear. You can also get it in a gel or a cream or a spray. And you do have to be careful with that because it could transfer to another person. So you just kind of need to wait for it to fully dry and absorb and maybe
Okay.
apply it in a place where it's not going to, directly contact the skin of, a partner or a child because that could then be absorbed through
Is
their
there a fear
skin.
with pets too? Because anytime I put lotion on, my
Yeah.
dog like wants to lick it.
Yes, yeah. So I did try gel for a little while, and my dog would like want to come. She does the same thing. She always like licks my skin after I put. So I had to make sure I like locked her out of the bathroom when I was putting it on, and then
I'm like lotion drying here.
right. Then it goes to the top of your thigh. So like once it absorbs, then I put my clothing on. Then there was no way she was gonna interact with it. But that is a consideration. But that's why a lot of women just wear the patch instead, so they don't
Hmm.
have to worry about that. But everybody kind of absorbs differently. And then the other thing I wanted to mention too is that a lot of women think that they are not going to be candidates for menopause hormone therapy because they didn't tolerate birth control. But birth control
Mm.
and hormone therapy are two totally different things. So birth control is this synthetic, there's synthetic hormones, and that's very high dose because you're shutting down your system, you're shutting down ovulation. And so it's a high dose of hormones that are synthetic hormones. And menopause hormone therapy is a very low dose. It's just giving you a tiny bit back of what your body has made, and it's not shutting your whole system down. And most of what is prescribed today is bioidentical hormones. So I didn't take birth control, or I did, but I didn't tolerate it, and I was getting a lot of migraine with aura. So my doctor told me I shouldn't take it because it was too high risk for me. So, but I do absolutely great on menopause hormone therapy. Actually, I haven't had a single migraine since I've been taking it. So I
Oh,
just don't
wow.
want women to assume that because they couldn't take birth control, they can't take menopause hormone therapy. You very likely can. You just, it's safe for most women. You just have to, find an expert to help you decide if, it's right for you.
So I know that you are so passionate about spreading your education and awareness. So what are a couple of things that you wish all women knew?
I wish they knew that this is the time of your life where you have to prioritize yourself. I think so many women are moms. They're just taking
Hmm.
care of their kids. They're taking care of their spouse. They're probably taking care of elderly parents at this stage of life. This is like the peak of your career where all of these symptoms start. And it's very easy to just put yourself and your needs last. But this is the stage of life where your body is going to tell you that you need to prioritize your health first, and you really need to do what you need to do to take care of yourself before you can take care of everybody else in your life. If
Right.
this is the stage of what you got away with in your 20s and 30s, your body is not going to let you get away with
No.
once you're in your 40s and 50s. And it's okay, it's not selfish to prioritize yourself and your health and your well-being before your families.
Yeah, I think that's one of the things that Jeanette and I always try to do is make sure that we're normalizing asking for help and talking
Yes.
to your friends and your peers. Like the more conversations around this, the more,
Right.
we can all share. And this must just be the Gemini in me. But anytime I learn information, I'm like sharing, and
Yes.
I want people to know that they're not alone and they don't have to suffer.
Absolutely. Yeah. And I think there's like sort of a shame and stigma associated with menopause because it involves aging. And as women, we don't
Mhm.
want to age. We don't want to admit we're getting older. But, women openly talk about their periods and their cramps and then all the goriness that goes into childbirth and delivery. And they just all of a sudden, when it comes to menopause, it's like, oh, don't talk about that. And why?
Yeah.
We should talk about it. We should talk about it. And the more we talk about it, the more we normalize it. And then the more
Yeah.
women realize there are absolutely things that you could do to make yourself feel better. You do not need to suffer through menopause. I feel better than I've ever felt. I'm healthier than I've ever been. So
Right.
you really don't have to suffer.
Right. And you're not broken. So let's just
Definitely
do
not.
like we're going to do a little quick fire round with you here. So,
Sure.
what is the worst symptom that you weren't expecting?
Brain fog, memory issues, word finding. I had no idea that was a menopausal symptom. And yeah,
Yeah.
that was definitely my worst one.
What about your favorite self care ritual?
For me, it's strength training. I know that sounds crazy, but I love my time in the gym. I love lifting heavy shit. I love being strong. I pick up, so in my day job, when I still work at a rehab hospital, I still have to pick patients up and get them out of
Yeah.
bed and
Mhm.
move them around. So I need to be strong for my job. But, I love feeling strong, and you kind of feel like a badass when you're lifting heavy stuff. So
I love
that's
that.
my self-care.
What's one thing you tell women over their 40s?
Well, that you should know the symptoms so that you're prepared for them, for sure. Have a menopause plan. Know what the symptoms are.
Hmm.
Maybe find a physician that you can use when you get to that point where you're considering menopause hormone therapy. Do your research on hormone therapy and decide if it's right for you. Don't wait until you're feeling horrible to do something about it. Sort of educate yourself on the symptoms, have a plan in place, start making your lifestyle changes now. The sooner the better. And yeah, just make sure you're taking care of yourself.
I love that. So before we wrap up, I want to leave our listeners with a little moment of reflection for the week. We're going to be building a Facebook community where the conversations can continue in there. So we'll drop that in the show notes. But so I think that the challenge this week is let us know what is the one thing that you learned about throughout this whole journey here, because community is everything. And if you can just think about one symptom or one shift that you have been brushing off and ignoring, something like that you can start giving your attention to, and really, going with that. So maybe it's like, I can make one small shift in my sleep changes, be more aware of my mood swings, and just whatever it is, write it down and acknowledge it. So, because you're not imagining things, it's so easy to think.
And simple lifestyle changes really can make a big difference. And just implementing them gradually. No one can change everything. And that's what I help women as a coach do is you hear all this on social media that you need to take 12,000 steps a day and lift heavy 3 times a week and eat 30 grams of protein at every meal. And the list goes on and on and on. And that can feel overwhelming. You have to gradually change things and slowly implement lifestyle changes. So it's not overwhelming. And so you stick to it because you can't change all of that at once and expect to stick to it. And I think some women try to do that and then they feel like failures, and you're not a failure.
You burn out too fast. Yeah.
That happens to me a lot. And that's even like as an example, when I started on the GLP-1s, I was like, the only thing I'm going to do is just take this shot and see if this works. And then I, saw the results, got the, weight loss down. Yeah. And then you start adding.
Then you add the lifestyle.
Yeah, totally. So Julie, tell our listeners, where can they follow you for more and, partner with you on this journey?
So you can follow me. I'm the Menopause OT on Instagram, TikTok, and YouTube. And my website is themenopauseot.com. I have a lot of resources on there, tip sheets for things like sleep and nutrition and strength training. There's directories on there for where you can find a menopause-informed provider. And then you can schedule a consultation with me on there, or you can sign up for coaching on there. So please come find me. And if you mention seeing this podcast and listening to this podcast, I will be offering $100 off all my coaching programs.
Ooh, awesome. I love that. Thank you so much for that, Julie. It's been awesome hanging out with you. So everybody make sure to keep listening and subscribe on Apple Podcasts or wherever you listen to podcasts. Follow us on social media at A Holistic Dose on Instagram, TikTok, and YouTube for more fun, and visit our website, aholisticdose.com. And thanks so much for hanging out with us.
Thank you, Julie. I learned so much.
Great. Thank you for having me.
And we're going to continue
with menopause. So.
Yeah, we have definitely. There's going to be more to come with you. I know we want to cover, how men can feel that they can support their ladies in their life with this too. But really, thank you so much. And we'll be back next week with more unfiltered friend talk right here on A Holistic Dose.
See you next time.
Bye.